Anticonvulsants, final exam, and VTNE review. The first drug we have is Diazepam, also called Valium. Diazepam is the generic and non-proprietary names. Valium is the brand name, the trade name, and the proprietary name. Is it controlled? Yes, control Schedule 4, as you can see in the upper right-hand corner of the label. How long does it act? Is it long or short acting? This is going to be short acting drug. This is a short acting drug, so when we are concerned about seizures not resolving, we may need to redose this drug, of course, at your veterinarian's discretion. Which routes can it be given? This can be given PO, IV, or rectally. It can come as a rectal gel, or the injectable form can have the needle removed and it can be administered rectally. To cats, this is PO. Valium is the only way that we should administer PO format of Diazepam Valium. Valium is going to be the brand name, trade name, proprietary name, and this is the only route that it can be given PO. This is the only drug it can be given PO to avoid irreversible liver failure in cats. The injectable forms of it are okay to use either one, but by mouth, Valium is the only choice. And which route should be avoided and why? We should not give this intramuscularly because it is very painful. Propylene glycol is a preservative in it, and this does not go well when it's injected subcutaneously or intramuscular. It's very uncomfortable for the animal. This drug is best administered IV, PO, or rectally. Phenobarbital, also called luminol. Controlled? Yes, this is control Schedule 4. Does phenobarbital stop seizures entirely or something else? It will lower the frequency and severity of seizures, but it will not do away with them entirely. So we can still expect periodically seizures to happen, but it is something that should not be happening as frequently once they are on the drug. How is it measured? It is measured in milligrams and grains. If you notice in the labels, we have 65 mg per mil for the injectable format. And on the bottom for the tablets, we have 64.8 milligrams, which is equivalent to 1 grain. This can also come in half a grain, quarter grain, 1.5 grain as well. And 64.8 is the true measurement in milligrams, although as you can see from the label at the top, 65 mg per milliliter is another route that they or another way that they will write the milligrams for this drug. Side effects, what should an owner be prepared for? We should expect drowsiness and lethargy for likely the first 2 to 3 weeks of medication. Once that has passed, the animal should start acting a little more normally, but it will take several weeks, and this is something the owner should be prepared for. How long does it take for the patient to act normal again? 2 to 3 weeks. Which blood tube should be used to check the levels and why? This is a non-additive, red or white top, depending on the brand of blood tube you are using. Serum separator gel will artificially reduce phenobarbital levels in the serum with prolonged contact. So it is not advised to use serum separator gel when drawing blood for a phenobarbital level check. Next up is potassium bromide. And these are liver-flavored chewable tablets for potassium bromide. Why is this called an adjunct drug? This is called an adjunct drug because this needs to be given at the same time with other drugs. This is seldom used alone, and this will be used to help improve the efficacy of the other drugs. So if phenobarbital alone is not controlling seizures well enough, we can also add potassium bromide. Potassium bromide can also be added to drugs like Keppra as well. How long is the half-life? Is it short or long? This has a long half-life, days even. And so this means that when we put the animal onto this drug, it can take weeks to months for it to hit the full level in the serum for it to be working effectively. How is the therapeutic index? Is it narrow or wide? This has a narrow margin of safety, meaning the level that works and the level that's toxic are very close together. A narrow margin of safety, or a narrow therapeutic margin, very close together. If we had a wide therapeutic margin, then the level that works and the level that's toxic are going to be much farther apart. But in this case, narrow margin of safety, which means calculation errors could be lethal in some patients. And why should this be avoided in cats? This should be avoided in cats because it can cause bronchitis. Lavatoracetum, also called Keppra. Know that this is used as an anticonvulsant. It is one of our newer anticonvulsant drugs, and it is very popular in practice. It is more expensive than the alternatives. Know how frequently it can be dosed, and why is this preferred? PID dosing is going to be considered for this. And so keep in mind that keeping closer together drug intervals may be more effective in some of our sensitive patients or patients that are still having seizures. But also keep in mind that TID dosing can reduce the compliance from an owner. If they have to work, they may not be able to administer a midday dose. So this is something for you or the doctor to be talking with the owner.